Okay, let's start. So welcome everyone to this Bruegel event on AI, big data, and how we can use such kind of technologies in our fight against the coronavirus, which affected all of us in many aspects of our lives. And it is a great pleasure to have together with us some really great and influential speakers on the topic. We have Alexander Penland, who is a professor at MIT Media Arts and Sciences Media Lab, and he directs the MIT Connection Center, and also is the head of the research group on human dynamics, whose research will be very relevant to what we will discuss today. As a background, let me mention something that it is very relevant also to the discussion, that he had contributed actively in high-level discussions that led to the adoption of the new EU privacy regulation, the GDPR. We also have the great pleasure to have with us Marietje Sake, who is the International Policy Director of the Cyber Policy Center at Stanford University. She has a long experience in European politics. She was a member of the European Parliament since 2009. And in her portfolio, she dealt with many issues, including technology, but also fundamental human rights. And of course, it's a great pleasure to have J. Scott Marcus, the in-house Bruegel expert, senior fellow at Bruegel, who recently published a blog post on big data and the coronavirus, as well as he has a long experience working on digital and telecom issues, which will be relevant. So some housekeeping remarks before we start the discussion. First of all, the audience can use Slido to post a question. The code for the Slido for the event is hashtag AI COVID. Please pose the question, but also see the questions of the other. Give a thumbs up, because I will probably select among the questions that they are the most popular. How we are going, what is the structure of the event today? Is that we will have a first round of discussion with the speakers. I will ask all of them questions related on how you can use applications of big data and AI to address, to contain the virus. What are the implications for fundamental rights and privacy regulation? And this will be the general topic of the first round. Then I will see your questions. I will bring them to the speakers. And then in the second round, for the time that will be remaining, hopefully it will be enough time, we want to discuss a little bit what our current knowledge and data says for the future, for the impact of the policies that have already been in place, like social distancing, but also on what should we expect in the future with respect on the value that these new technologies can bring, and also how the situation with the virus will be evolved. So without further ado, I will start with Sandy. Sandy, you have an extensive experience on mobile applications, on big data applications and social networks, definitely that can be very relevant with many aspects on creating a response against the COVID-19. Could you give us some insights of how we can use data and mobile applications to do that?
So there's a fundamental tension between privacy and government being able to behave appropriately and transparently. If everyone were completely private, then the government wouldn't know where you were, they couldn't deliver services, they couldn't have appropriate policies. So there needs to be some sort of trade-off there. The work I've done, thinks about how do you do that. And for instance, It's written into this UN Sustainable Development Goals that each country should be able to measure certain things using data like this, but also satellite data, other data, very much like a sort of a rich census data. So not individual level, but at the level of census blocks, which is something we're familiar with. And that's really important also because the average person on the street sort of understands what the census is for, and that assuming that it's done correctly, it doesn't threaten their individual privacy. And with the correct sort of policies, it's public and open and promotes sort of transparency. So in the case of COVID, we hit this sort of trade-off really right on. So complete privacy means you don't know what anybody else is doing too, which means you have no idea of your infection risk, and the government policies don't know what to do. And we see that across the world. Every different government is trying different things, some slow, some fast. It's not a scientific experiment. It's like learning through hard experience and not very well. And so what you're seeing are governments essentially commandeering data from carriers, Facebook, Google, etc., to be able to give a picture at the census block level of what are the flows of people, what are the rates of infection, which comes from taking data from the medical system. And they're trying to work out the trade-off there. And we've done quite a bit of work in looking at, should you close schools or not? How long? Should you quarantine people? The Chinese example appears to show that you can actually tamp this down, but at huge cost to personal liberty. Things like Korea and Singapore have a much more sort of compliant, cooperative, trusting society. And they're a little less sort of violent about this. But that's not going to fly in most of Europe or the US. And so what we're trying to do is make sure that things are secure, both through use of law. For instance, medical systems have all sorts of data about you, and they're pretty good at protecting your personal data. And so using that mechanism, using technical mechanisms about encryption and so forth, so that data isn't revealed. And what we're being pushed to do is, develop these systems very quickly so we can get the same sorts of effects that you saw in Singapore, say, or Korea, but without endangering privacy, being GDPR compliant, being more than that also, and trying to also be transparent. And so there's a big battle because I've heard leaders of several countries say, but we have to do something now. We'll use the system that's open source from Singapore, even though it tramples on individual rights. So that's, shocking, but you sort of understand what their position is. They're trying to save lives. And so our role is to be able to provide alternatives to that. So when the leader says, I have to save lives, there's something they can do that doesn't trample on individual rights.
I see. Very interesting. And as you said, it is very challenging to deal with this trade-off you mentioned between the value I can bring and the rules that I need to follow, like privacy rules. And also, it was very interesting it is very interesting to compare how this trade-off is conceptualized at different parts of the world. With respect to the coronavirus, you have a new ongoing project, the SafePass project, which basically try to deal with this trade-off in a way that can bring value. Could you please give us a quick view of what is this about this project and how do you deal with the privacy issue there?
So it's an ongoing developing thing, and the idea is to bring in some of the big players that are worldwide and get them to adopt frameworks that protect individual privacy. And the way you do that basically is providing cryptographic solutions that allow you to share things that are only about the individual to the individual, and yet be able to get these sort of aggregate insights. And there are a number of sort of standard ways that we do things like this already. I mean, I'll just give you an example as a mental model, is whenever you use a credit card or a phone, the only people that have available that data are you, the merchant that you buy from. Even like MasterCard and Visa don't have access to what you bought. They just help move the bits around. And then your bank, which has to do the payments, does. But it's a pretty good and secure system, not perfect. And so it just shows that there's already been systems out there that are at the individual level, at the global level also, which are moving in the correct direction, at least. And so what we have to do is try and leverage some of that technology, some of the legal frameworks, to be able to do the same thing around medical data.
I see. I mean, a successful tool needs to have good information about the infectious. So collection of data on the infection side would have been a direct violation of privacy?
Today, in most countries, when you get an immunization or you get a medical test, that data is held by the medical system, right? Those are your medical records. So that's not considered an invasion of privacy because there's regulatory environment around it. The problem here now is that you have to be able to look across all of those things and be able to relate your infection to the people that you may be talked to. And that's called contact tracing. In order to let those people know that they may be in danger, test them quickly and take appropriate medical action. And so you can't, in the case that you're infectious with a disease like this, the rules are somewhat different. They have always been different. For tuberculosis, polio, for, et cetera, et cetera, et cetera. And so we're trying to hit the right sort of balance between being able to warn people and deal with them appropriately, and protecting their right to go about unimpeded.
I see. But such systems are very interesting, but can be successful only if we ensure the mass participation of people on that. So that to have enough data to be able to use it in our benefit and contain the virus.
Well, the first order system doesn't need that. The first order system needs to be something that the medical people use. So every time you're tested, every time you're hospitalized, every time you recover, that already gets recorded. But we need to be consistent about how that happens and be able to use that to warn people as needed. That's the 0th level system. The next level system is being able to allow citizens to understand what the situation is. And that's the place where people, unfortunately, sort of leap to these privacy invasive systems.
I see. Okay, very interesting. We'll come back to that. I would like now to turn to Marietje and talk a little bit about this trade-off between privacy, fundamental rights, and the weapons that we have in our hands against this virus situation. I mean, how do you see the current ongoing initiatives of using technological means to screen population? We have examples in Europe. We see and we hear from politicians the intention of governments to get some synergies with digital and telecom firms which are under development. Sandy provided some insights on how the screening of population could work. What are your views on the role of privacy in these developments in Europe?
So thank you very much for inviting me and for putting together this important panel on a difficult topic. First of all, My heart goes out to everybody who is impacted by the virus and the measures. It is an unprecedented time, and I hope we can hold tight to our loved ones and communities in these hours of challenge. And so it is understandable that a lot of people in government, but also in technology companies, are thinking about ways that they can be constructive and find solutions. However, I think we have to be very careful to suggest, or not to suggest rather, that there is a magical solution coming from the technology. There isn't. Another challenge is that I hear a lot about, trade-offs and privacy and rights. We have learned the hard way in Europe, but also in the United States, in our so-called free and open societies, in the sense that crises, for example, after 9/11, the war against terror, that crises have often been used as a pretext to erode rights in a way that are hardly ever repaired. And I think that more stringent privacy protections are actually an answer to those erosions. And so it would be a huge mistake to now pretend that we can just park those aside in the interest of drastic measures. A couple of ingredients that we need to zoom in on when we look at the role of technology. One is doctors are already using artificial intelligence and data analysis in the medical context. And there are, in most countries, strong protections of how medical data is protected in terms of, its sensitivity, the privacy rights of patients, etc. So we see artificial intelligence being used for medical imaging, for example, but also big data analysis, pattern recognition over vast amounts of data. And I think when this is done in a medical context, it's a completely different context than when we would see private companies processing data or proactive mass swooping up of data to see what to do with it later. So you need to have a clear function description. You need to understand the purpose very well. And I think what Mr. Pentland explained very clearly is that testing of patients, in other words, knowing the situation of a patient in order to then, document and possibly process that data is crucial. And in a lot of countries, including my own, patients are not tested on a massive scale. So the question is really, how do you relate relevant information processed according to the rights that should remain protected, even if we're going through a crisis? And I would say again, if we are implying that the technology has a magic solution, I also fear that we can create a false sense of hope and a false sense of security among people. And there are risks entailed with that too. Because imagine if there's people who've downloaded an app, imagine that they've opted in, which is a different context than, top-down forcing of the use of these apps. But let's say they've opted in and the impression is given that this creates certainty. They can just go out, and unless they get a message that they should quarantine, there is no risk. We have seen how difficult it has been to do physical distancing. I hope it doesn't mean social distancing in the sense of not being in touch with each other, because I think it's really important. But physical distancing is crucial right now. And I would hate to see a notion where an app gives people the impression that they don't have to be careful with physical distancing anymore. So I'll leave it at that for now. We have to be very clear that it's not presented as a magic wand, that rights are respected, and that we have relevant data for relevant purposes only.
Thank you. Sadi, do you want to react to that, or I continue the questions?
I could endorse that 100%. The one thing that I'll point out is that just like there's complete lack of clarity in policy at the moment, in part because the sort of thinking you just heard is lacking, but also because there's no evidence about what works and what doesn't work. The technology is a moving target also. There is what's possible, and then there's what's possible to actually deploy at scale. And those are often quite different. And there's different actors that have somewhere between subtly and very different motivations. And so it's not a technology solution or a technology, it's this whole spectrum of things. The sort of clarity that she was talking about, I think, is very clear I expect that different societies will make slightly different choices, but probably only slightly, because of this risk of view systems being co-opted and used in ways that are unforeseen. You know, the emergency system somehow ends up being permanent.
I'm glad to see that we have a homogeneous approach on that. Scott, I want also to bring you on the discussion. Do you want to reflect on what already said? We discussed about the trade-off between privacy and technology, the fact that we should not use this as an excuse to violate privacy rules. You have been working extensively on big data and issues related to data sharing, privacy. What are your views on this?
Well, I'd like to start by endorsing the very thoughtful comments from that we've just heard from both panelists. I think that these are really spot on. These are very much exactly the issues. I would say if you look at the experience in Asia, it's clear that the contact tracing that has been done there in terms of reducing the rate of new infections has been part of a successful formula, right? If you look at China, which was the first country to be hard hit, their number of new cases per day is greatly reduced. You could say the same about Taiwan. The same really applies to Korea, which is a country that we generally view as a democratic country. Taiwan also. So clearly there are different recipes that have worked in different places. It can be helpful, but the way they got there is not a way that most Western democracies would accept or welcome. Only under the most extreme circumstances and only for bounded times would anybody accept them. And that raises exactly the concerns that that Sandy and Marietka have raised, which is really how long can these things be put in place and maintained? Now, there are different use cases here. There are different things that can be done and they have different implications. Sandy was talking at the outset about anonymized aggregated data. And I think almost everybody in Europe that has looked at this, including the European Data Protection Board, including even privacy advocate Max Schrems, who has pretty strong views on these things, believes that if done correctly, that the use of anonymized aggregated data is okay. There are ways to get it wrong. Nobody wants to see the data hacked, whether it's aggregated or not. And also what's fairly well established is if the anonymization is not done thoughtfully, very often you can track back to the individual anyway. So clearly these things need to be done properly. They need to be done with proper thought. And one needs to invest the time and energy. I personally, having done a lot of software development, I don't believe that development of bad software is cheaper than development of good software. I don't believe that. You know, you should put the investment of energy in up front and get it right. Now, if we look at the use of contact tracing on an individual basis, that's much more delicate than the anonymized aggregated data, because there you do get into personally identifiable data. And so there the question is, how can it be done in ways that either are fully GDPR conformant, or if one were to take liberties, that are as minimal as possible. But a lot of what can be done is, I think, fully conformant. I'd say that an emerging view in Germany, my country, my adopted country, which has probably got some of the strongest views on privacy in the world, an emerging view is that consensual use of smartphone apps, if done properly, could be okay. This was, I think, a much more intensely debated issue a few days ago. I think a consensus is starting to emerge on this. The kind of work that's being done at MIT, there's similar work going on at Oxford and other places, seems to me to be in exactly the right direction, which is it's trying to ensure informed consent, not to put more data than is needed into public view. In the case of the MIT app, in the phase 1 implementation on the private kit, the data never leaves the phone until someone is diagnosed, at which point they can choose to make their location history available to authorities. That's informed consent. I don't see where there's a problem with that. It gets much dicier when you get to issues like, for example, mixing smartphone location data with credit card data. You know, there I think the question of how you get informed consent becomes a lot dicier. And I think also the scale issues that Mariette also raised become an issue. If we have a purely voluntary system, do we get enough participation? If we have multiple systems, can we get enough participation across them? If we combine data across them, again, how do we get informed consent that that's permissible and that the user accepts it? So I think there are issues to be done. Now, I also like to give an example. Anytime I'm looking for an example of what not to do, it's convenient to be an American because I have no further to look than Mr. Trump. And if you look at the way that he announced a few weeks ago, a health system to assess whether people should get themselves tested, he prematurely announced a system, even incorrectly announced which company it was coming from. It was a sister company to Google, not Google itself. There were so many errors in what he announced that Google itself had to issue a retraction. And people were deeply unhappy with the fact that to get into the system at all, you had to have a Google account and log in, which of course raises instant questions as to whether the data will be abused for commercial purposes. So here, I think there are a couple of messages. The first big message is clear, accurate, proper communication to the public. No more inclusive data collection than is necessary. Obviously, proper security safeguards are going to be important, but most critical, both for commercial data and also for government data, is that the data doesn't get repurposed for other reasons. I mean, governments would probably love to use some of this data for tax enforcement and other things. Commercial companies would love to reuse it for advertising and other purposes. I think there clearly has to be an understanding that the data is used only for purposes intended. This is absolutely consistent with GDPR principles. I think here it becomes especially important. As a last point, I think the question that we've all raised is the same question I used to hear from the back of the car years ago from my kids. Daddy, are we there yet? How do we know when the emergency has been resolved? How do we know when we no longer have to worry about it? How do we know when we can destroy the data? And in particular, how can we ensure that authorities really do it when they're supposed to do it, that we really ease up on these things? What we've seen in many cases, for example, the Cambridge Analytica case, Cambridge Analytica certified that they destroyed the data they were hanging on to, but they hadn't. They continued to use it, they continued to sell it. The issue with surveillance authorities is nobody's really in a position outside of them to police what they're doing. Even law enforcement is less of an issue because law enforcement usually has to go to a court and show that they've collected data properly. Surveillance authorities, very hard to know what they're doing. It's a real challenge. So again, I think there's a strong argument data collection shouldn't be more inclusive than useful, and governments should pretty much swear in blood not to keep anything extraordinary in place longer than absolutely needed.
Can I jump in just for a minute?
Yes,
so,
please.
So I think that's a really great introduction to something which is, I think, a principle that you see in some countries, like Estonia, for instance, which is that you don't share data. You just don't. And when you do share, what you share is you allow other people to query the data that, for instance, if you're a health system that you hold, which means you have a record of who asked the question, what question they asked, what was the answer, what data went into it. And so it produces a continuous audit of the use of the data by whom, for what purpose. As humans, we tend to think about, oh, we're going to get all the data and put it in one place or something like that. And that's exactly the wrong thing to do, both from a security point of view, but also from this notion of auditing and control of data. A system where you have sharing of answers, but not sharing of data. And we refer that to as open algorithms because you actually have to send algorithms to people so you can see what the queries are and test them and so forth. Is the sort of thing that Estonia has. It's not difficult to set up, but it gives you the possibility of continuous audit. And at least in some of these cases, it's proven to work quite well. You have to, of course, be thoughtful and rigorous about it. But this business of like sending data everywhere, that's really the root of the problem. We shouldn't be doing that. almost ever. Right?
Good points, Sandy. Let me try to bring also some questions from the audience. Probably I will start with the first one. Probably Marietje can go forward and answer it firstly. I mean, it refers to these risks for fundamental rights. During time of crisis, fundamental rights probably the concerns around fundamental rights are overseen. The question is how we can ensure that this is something temporary and it will not become the norm.
Well, I would like to take one step back and really zoom in on the question of, do we need this at all? So picking up from one of the other speakers, some of the things the other speakers have said, which is one, that allegedly the use of technology is helping the amount of cases in China. I would put against that we don't exactly know what is going on in China because the information flows are opaque. Foreign journalists have been expelled from the country. We've seen the hiding of crucial information about the coronavirus in China, which has led to a lot of spreading unnecessarily. So I would not conclude prematurely that there is a success in China and furthermore to attribute it to the use of technology. However, in a couple of Asian countries, true, the numbers have been gone down. The curve has been flattened, as is the terminology these days. But one crucial ingredient there is also the collective or the almost universal wearing of face masks. And so we have to look at the several ingredients here that have to come together. In Germany, which was also mentioned as an example, there is a high volume of testing, which is, I would imagine, a precondition to even make relevant connections to data and proximity between people. Because if we don't know who might carry the virus, who has carried the virus, then what sense does it make to know where the person has been? So before we start talking about the use in Europe, and before we start even talking about exceptions to rights, which I'm not convinced is necessary. I've seen a collective of researchers suggesting that there can be a Bluetooth-based approach, which does not have the same kind of privacy risks or top-down use of data that we've heard. Now, we've talked a little bit about how governments might be interested, especially non-democratic ones, to gain access to massive amounts of data. What I think is another component here is the push by some companies to play a role here, which we also have to question with critical understanding, which is, is this an indication of trying to be helpful? Or is there also a risk that a opening that's being granted now could lead to other uses later, or to stretching, let's say, the role of companies and their use of data and their collection of data under the pretext of it helping Corona. So helping solve Corona. So I think there are still a lot of questions, and I want to emphasize again that I would hate to see a kind of false security coming from technological solutions until it is really clear what they can bring us. And my sense is that there is a number of factors involved that will determine whether there is a chance for technological solutions at all. And I think that in Europe, we owe it to ourselves, to our principles, our constitutions, the general data protection regulation, and the history from which we've learned so many painful lessons, not to repeat those painful lessons from the past. And if anyone wants to consider it, which I'm sure they do, then I think there has to be absolute proof that the exceptions made are going to lead to something. And I have not at all seen any evidence that there is a need to sidestep privacy protections for the use of technology in the fight against the coronavirus. And trust me, I mean, every one of us would love to see a solution. So it is not for a lack of will and determination to get through this, but it is for really, the need to do it within our principles and our values. And I believe that that is possible. So let's focus on those solutions and not on what we should do to sidestep our rights.
I add one point to that, which is that this conversation so far has been Eurocentric and US-centric, and that's a very small percentage of the population of the world. So some of the people that I talk to and try to help are people like Orange, IBM, MasterCard, and they provide infrastructure to governments in other countries. And what they're interested in, the reality is what you adopt in the US, what you adopt in the EU gets spread to the vast majority of people in the world. And that's where the vast majority of deaths will be. That's where the risk of authoritarian government is larger and more immediate. And helping those people put in place even fairly basic things, again, respecting privacy, which is typically a little less developed concept in those governments, is to me a great priority. I mean, we shouldn't screw up in our own countries and our own societies, but there's another 6 billion people that could use doing this right. And the only people that can actually spread that are some of these big international companies. So I don't want to tar them with sort of bad intentions.
Clear. Thanks for this more international perspective, Sandy. I will move by asking you further questions. There are some questions for tracking and one specific questions for think tanks. So I will start with Scott to address the think tank question. So what are your key recommendations to think tanks working on the issues, on these issues in countries where COVID-19 crisis has already eroded the situation? And what to watch out for? Had eroded the human rights, and what to watch out for?
Well, we've actually had a fairly active debate within Bruegel itself on what exactly we should and we shouldn't be doing. A part of that is trying to strike the right balance between, on the one hand, understanding the epidemiological realities, but on the other hand, not jumping into the debate in areas that we ourselves aren't expert in. So somehow I think that has to be the case. Now, different think tanks will have different focus. So it'll really depend on what their deal is. But I think that that's the issue. Certainly for Bruegel, which is especially focused on economics, on macroeconomics, we look a lot at trying to say, you know, really what sort of relief is going to be needed for individuals, for small business, for large business. But fundamentally, this also comes back a lot to how long is the situation likely to persist. So again, I think it's important for the think tanks to take a forward-looking view, but also a bit to stick to their knitting, or sounding a little more American, not to drive beyond our headlights, not to actually jump too much into areas that we can't contribute to effectively.
I see.
If I can add a little point is, I think there's going to be a huge need for guidance in the masses of information that are being shared. We haven't talked much about disinformation and misinformation, but it's clearly a huge problem in this crisis as well. And on top of that, we see leaders of countries using the corona pretext to justify a whole bunch of things that they've probably wanted for a long time. I mean, look at what happened in Hungary. You know, the really sidestepping of democratic principles and centralizing of power is an extraordinary step that Viktor Orban has made. You know, he may well use the argument of corona now, but this has been in the works for a long time, even before this virus broke out. So I think think tanks should also consider playing a role in making very clear where measures are taken in sort of legitimate efforts to fight the virus, or to adopt economic packages and to take measures in policy and politics, and where it is unrelated, and where we can see that there's been longer trends of, for example, eroding liberties, or you know, in the economic context, whether they align with previous agendas that governments may have had. So to really contribute to the sense making in these complicated times, where we are also, on top of everything else that we're dealing with, facing overloads of information and deliberate undermining of trust in liberal democracy through disinformation and misinformation.
I like to take Yeah, I'm on the board of the Global Partnership for Sustainable Development that the UN has. So these are the 15-year goals of the United Nations, and they specify that we need to measure things like inequality, health risks, sustainability, and some of those measurements utilize data like the sort of things that we're talking about. And just in general, this is a microcosm of the larger questions. And what do we know about inequality? What do we know about gender differences? What do we know about poverty? A huge fraction of the world, including much of the developed world, we simply don't know how we're doing on many of these fundamental quality of life, basic human right issues. And so this is actually an opportunity to think through the broader issues of how do we use data in society? How do we inform society openly so that citizens understand, so that we have less corruption, but yet have effective governance? This is just, an acute example of a larger problem. In the last 50 years, there have been no food shortage, no starvation, famine issues that weren't created by poor government policy. But millions of people have died of famines. And it's just simply that we don't have our act together for measuring things, making them visible, and acting them on them. So the positive side here may be that we think about these issues a little bit more and apply the principles that the other two speakers were talking about to the broad range of problems we face. I mean, the coronavirus is acute, but hardly only issue like that.
Thank you, Sandy. I will move with a couple more questions from the audience. The two of them refer to tracking, and therefore we can start with you, Sandy, on that. In order for this type of tracking to work, should not the disclosure of information be compulsory for all? What are the political implications then? Again, we go back to disclosure of privacy issues. And a second one, which is, I mean, if tracking saves lives and it's limited only to health, then it is a civic duty to be tracked after tested. In a democratic state, it's a state for all of us, and such safety policies should be taken into account. So it's more than a common question whether we should see it as a necessary step forward.
Well, so I have a group of law schools that I've put together. If you look at law.mit.edu, that are putting together international consensus about these sorts of things. Different countries have somewhat different views on it. So if you test positive and you're supposed to go home and quarantine yourself, isolate yourself, what happens if you don't? Different societies treat that anything from a criminal act to something that's just merely irresponsible. And how you treat that, of course, relates to how much surveillance you have of infected people. So I don't think there's a general solution for different societies. A way that strikes me personally as sort of plausible is if you're infected and you need to self-isolate, it seems reasonable that the medical personnel would ping you, call you up every 8 hours, say, and say, how are you doing? Are you staying home? That's not quite surveillance, but it's getting there. As you move beyond that, it gets increasingly problematic. So I don't think it's, again, it's one of these sort of delicate trade-offs. It's so close to the edge that I think different societies will have slightly different ways of dealing with that.
Could I just add a point, because it implies that we are still at a sort of point zero and we can start designing all these complex processes and solutions from now on. But clearly, if there has not been a keeping track of people so far, then injecting it now, has limited effect. So I think it's important to look at these questions of tracking in the context of the other measures that governments are taking, with big differences to be seen between, let's say, Sweden, Germany, the United Kingdom, Italy. One, different policy decisions; two, different phases in the awareness or the knowledge about the amount of cases, basically different phases in the development of the virus in the society and for the individuals impacted. So what I do think is important is to learn from steps that we were not prepared for now from a variety of societies, but also to recognize that everybody is searching in this phase, right? I don't think there's any government that has a perfect solution, to be honest, because everybody was overwhelmed, everybody was surprised. And so, again, I think it's important to look clearly at what is and is not possible, even if you were to start with some of these tracking processes today. They do have to make sense within available information and policies that have already been rolled out.
Actually, if I could jump in here too. So on the one hand, perhaps a bit different from Ms. Shaka's view, I do think in countries like Korea and Taiwan that the tracking has been positive. But I also think it's really too early to be thinking about mandatory tracking in Europe, at least in Western democracies, at least in the case of people that haven't already been shown to be infected. I think that we should be giving voluntary solutions a chance. And I think the kind of work that's being done at MIT and Oxford here is really a good model for the kind of things that could work. I believe technology does have a role to play here, but I think the solutions that are fully conformant, which we're more willing to invest time in than Korea, Taiwan, or especially China were, they should be given a chance here before we take further steps. I actually would say, though, I think we're still really in quite an early stage relative to the total number of cases. There is time enough for policy to have a pretty substantial impact. I don't think we should underrate that.
I'd have to agree, if only to be helpful. I'll point out that if you are infected and you go out in the street and infect other people, in some society that's viewed as essentially an attempted manslaughter, right? It's a serious crime. And we have existing systems for doing that. We put ankle bracelets on people who are released from prison, who are dangerous to society, but not so dangerous that they need to be in prison. I think that's a little far for this. But we also deal, for instance, with released sexual predators the same way. They have to have tracking on their telephones. They have to register where they are. So there are existing models, and the question is does this rise to that level? I think the answer is no, but not every society may make that decision.
Could I just clarify, because obviously I never meant to imply that I think that people who are contagious should be walking around, willfully putting others at risk. But let's look at the entire chain of questions. I mean, are there other protections that we need? For example, universal mask wearing while we are unable to test on a massive scale. If we are unable to test on a massive scale, then we must assume, whether we like it or not, and I don't like it, but that there are a lot of infected people who have already walked around and who are walking around today, some of them without symptoms, probably infecting people. And so I agree with what was said about, this being an early stage in the full sort of, span of the corona crisis. But there have been decisions made, and also different policy decisions in countries like in the Netherlands and in the United Kingdom. I think it's only recently been changing away from the notion of so-called herd immunity as a consequence of policy, meaning that if a number of people were to be infected, it would eventually lead to greater immunity. Now, if that is your aim, which, you know, I'm happy to have a side discussion about whether that's a useful aim, but it is a policy that was chosen by these countries for a while, then you have different objectives, different approaches, where the tracking question takes on a very different meaning, and where, for example, it might also be very important to know who is immune, whether there is immunity, and if so, who is immune, so that you can then deploy these people to do meaningful things in society again. Anyway, there is a big link between where tracking might play a role, under what conditions, and the already chosen policies or the evolving policies, because I think we see some 180 turns in a number of cases as well. Notably in the White House, there seems to have been a fundamental shift, at least in tone, possibly also in policy. But what has happened in the meantime is a big question. And there are still states in the United States, because there is no strong federal guideline, where people actually have a lot of freedom of movement. In the Netherlands, for example, churches were an exception for a while, where 30 people could still congregate in religious communities. Well, you know, all kinds of consequences of policy is all I'm trying to say. And I think it's important to keep connecting the expert view, whether it's data experts, medical experts, virologists, and then the translation to policy. Because those policymakers at the end of the day are accountable and responsible for looking at enforceability, looking at implementation, and looking at the societal impact, not only the medical impact.
Thank you. We have less than 10 minutes left. Unless you have something to add and comment more on this, I have 2-3 questions, one coming from the audience, refers to the digital and pharma firms. The question says that they have a unique opportunity to reinstall their reputation. And the real part of the question is whether we should thinking about them as public utilities. Is there any reaction to that?
I guess I would say I work a lot with regulation of network industries, especially with telecommunications. Usually the regulated industries somehow control something that nobody else can provide. Whether it's sewers or water pipes that go to the house, electric lines or telecom lines, where it's not impossible, but difficult for there to be a second or third source. For companies that are providing social networking or search, I think it's hard to argue that there's a similar barrier to entry. I do think, however, that there's a very constructive role that the various platforms can play in this. I can understand Ms. Shaka's concern that they could overplay this and try to use it for their own ends. But I also think that well, at least some of the people I talk to, I think genuinely want to help. And this is an opportunity for them to do it.
Another question has to do with the AI.
They could overplay this and try to use it for their own ends.
Yeah.
But I also
can you
think
hear me?
that
I hear again, Scott.
There's an echo.
Yeah.
I think genuinely want to help. And this is an opportunity for them to do it.
Another question has to do with the AI.
Could overplay this and try to use it for their own ends.
Yeah.
But I also
can you hear me? I hear again, Scott.
There's an echo. I thought once was good enough. And this is an opportunity for them to do it.
Another question. Okay, we have some issues with this. Probably internet likes a lot of the remark by Scott.
Yeah. Can you hear me? I hear again, Scott. There's an echo. I thought once was good enough.
If the team in Brussels can help with that, it would be great. Okay, we have some issues with this. Probably internet likes a lot of the remark by Scott.
Once was good enough.
Okay, it's difficult to have a discussion with this in the background. There are only 5 minutes left. So I propose, I had a couple of questions more to ask, but I propose to stop here. Thanks so much for being here with us. Highly appreciated. Thanks for sharing your views. and we will follow you, your research.
There are only 5 minutes left.
Take care. Bye.
So I propose, I had a couple of